Well, thanks for having me. Before I start, I just wanted to say happy anniversary to Medicaid and to my incredible wife, Kate, today. My name is Dale Terasaki, and I'm a fourth generation Japanese American and a third generation doctor in my family. I work at a safety net hospital in Denver, Colorado, primarily treating addiction, and a huge majority of my patients have Medicaid. It's an essential lifeline for them, but I also wanted to share about how Medicaid was a lifeline for myself as a patient. When I was in medical school, the Affordable Care Act, also known as Obamacare, had just passed. And I was fortunate enough that I was a resident of Washington State, where the governor chose to expand Medicaid to cover people like me, a student taking on debt to pursue my career. While traveling abroad in 2013, I ended up getting a flu-like illness that turned out to be an infection. But like COVID, it was no ordinary disease. This was a bacterial infection that latched onto the inside of my heart called endocarditis. Endocarditis can lead to things like septic shock and heart failure, stroke, and other life-threatening complications. For me, the life-saving fix was open heart surgery. And luckily, I walked away with no serious complications. The hospital stay, the surgery, the cardiac rehab, the antibiotics, Medicaid had me covered. It's part of the reason I'm still here today. Currently, many of my patients also have endocarditis due to another public health calamity that did not go away with COVID-19. I'm talking about the crisis of opioid and other drug addiction. Unfortunately, heroin and methamphetamines can carry bacteria into the bloodstream when injected, leading to terrifying and costly infections. Can we prevent those from happening? Well, Medicaid covers treatments like buprenorphine, a medicine that helps my patients not feel horribly sick and crave opioids, plus overdose prevention tools like naloxone and outpatient addiction counseling that is so critical to maintaining recovery. I'm so privileged that I get the chance to be in that fight. So my experience makes me eternally grateful to Medicaid and all the advocates that push to expand it. Grassroots activists, patients, voters, health policy experts, leaders in Congress, Vice President Biden, and President Obama, thank you. But I also want people to know that funding Medicaid is not just the right thing to do, it's an investment. It helps to support some of the people who will later join the healthcare workforce to fight the current COVID pandemic, the persistent opioid crisis, and whatever else is on the horizon. Medicaid and broader health coverage in general benefits our friends, our neighbors, our safety net hospitals, and our country's future. Please stand up for this vital investment in resilient, healthy America. Thanks for your attention.